Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. This week's episode was centered around the recently concluded ECTRIMS meeting. First up, results from a real-world 5-year prospective single-center study showed that most patients with relapsing remitting MS used alemtuzumab as a second or third line treatment with it displaying similar efficacy to what was observed in previous extension studies. The data also showed that despite previously failing a disease-modifying therapy, 76% of patients had progression-free survival and 33% had cumulative no evidence of disease activity 3 status. During the study, all patients reported receiving at least one course of alemtuzumab, and most, as in 50 out of 51, received the second. 16 patients had received the third course and 2 received the fourth. At each of the time points, except for month 36, median EDSS scores was 1.5 compared to a median score of 2 at baseline. More than half of the patients were relapse-free at the 60-month mark, correlating to an analyzed relapse rate of 0.12. Next up, findings presented at ECTRIMS 2021 showed that treatment with siponimod preserved retinal thickness, a marker of neurodegeneration, using optical coherence tomography in patients with secondary progressive multiple sclerosis. Patients in the siponimod group had mean baseline retinal nerve fiber layer thickness lower than those of placebo. After 12 months of treatment, our NFL thickness numerically favored the siponimod group over placebo. These results did not hold true at the 24-month mark. However, investigators noted that there were fewer assessments available for our NFL at the time. Compared with placebo, siponimod-treated patients showed reduced retinal thinning at both month 12 and 24. Notably, siponimod also favored over placebo on subfield changes of retinal thickness and ganglion cell and interplexiform layers. Lastly, updated results from the small open-label extension portion of the Phase 1 study of ATA188 in progressive multiple sclerosis suggest that the therapy has a sustained clinical benefit over 39 months based on magnetization transfer ratio while being safe and tolerable. In total, 7 of the 8 patients enrolled in the open-label extension achieved sustained disease improvement that was steady at all measured time points, with most SDI driven by improvement on expanded disability status scale scores. For those with sustained EDSS improvement, the MTR for unenhancing T2 lesions was improved at 6 months and significant improvement at 12 months, compared to those without sustained EDSS improvement. Overall, trends supported a correlation between increase in MTR signal and improvement in EDSS score as early as 6 months. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.